right, it is now 2:45, so we'll start. Hello everyone, welcome to the 2021 UNC Water and Health Conference, and thank you for joining our session. My name is Hania Zaneeb. I am representing the UNC Water Institute, and I'm your room host today. Before we get started, I have a couple of announcements. Let's see if I can set my slides moving. A quick reminder that we do have networking sessions daily, one during lunch and another one in the afternoon. One during lunch is on Pathable and the afternoon session is on Reno. The times are listed here, so join as it is of interest to you. Another quick plug to the late early show. It is a quick recap to the day's events for those of you who are not able to attend all of them. The times are again listed right here. It's 3 o'clock Eastern Standard Time. And lastly, I wanted to remind everyone that the chat function in Zoom has been disabled. So all chats should go in the chat box in Pathable. This is so we can record the chats even after the Zoom session has ended, and to keep the conversation going after the session too. So with that, I will introduce our four speakers today. The first speaker with us is Wyatt Champion from the University of South Florida. I think we are good to start. So if Elizabeth, you could share the video for Wyatt, we can get started.
Hello, and welcome to my presentation entitled Lead Poisoning of Children in Madagascar Related to Drinking Water and Environmental Risk Factors. My name is Wyatt Champion, and today I'll be presenting on behalf of the University of South Florida and our in-country partners, RENACICA. And thank you to UNC and UNC Water Institute for hosting the conference. Lead exposure of children is a global issue. An estimated 1/3 of children have blood lead levels exceeding the US CDC reference value of 5 micrograms per deciliter, placing them at risk of long-term health effects. These health effects include damage to the brain and nervous system, slow development, and learning and behavioral problems. The majority of children with elevated BLLs reside in low and middle income countries, primarily in sub-Saharan Africa, Asia, Central and South America, and Eastern Europe. Here, in these LMICs, an estimated 1/2 of children have BLLs exceeding the reference value. Unregulated and informal economies drive everyday lead emissions and exposures. More recent phase out of leaded gasoline results in higher levels of lead in soil and dust. Cultural and behavioral differences result in increased ingestion. Malnutrition and lack of access to public health awareness further compound these impacts. This burden results in an estimated loss of approximately $1 trillion in annual GDP in LMICs alone. Our study was based in Madagascar, one of the world's least developed nations located off the southeastern coast of Africa. In Tomasina, the chief seaport of the nation, access to piped drinking water is limited, owing in part to rapid urbanization in the past decades and limited infrastructure. Here, the use of manually driven hand pumps or pitcher pumps is common for self-supply of water, as shown in Figure 1. The use of lead weights, sourced typically from recycled lead-acid batteries, is common practice. Previous work by our team has determined levels of lead in the pumped water to exceed WHO guidelines. We measured BLLs of 362 children aged 6 months to 6 years and surveyed caretakers to assess factors related to demographics, socioeconomic status, diet habits, and additional potential exposure routes. This is shown in Figure 2. Using chi-squared and Kruspe-Wallace tests on both continuous and dichotomous BLL data, we determined significant factors associated with elevated BLL status, drinking and cooking, and location relative to a major roadway. Univariate regression also identified significant crude odds ratios, including male gender, several dietary factors, location, and some occupations related to low socioeconomic status. Next, multiple logistic regression was employed to calculate adjusted odds ratios. Those factors with statistically significant odds ratios related to elevated BLL status included the daily consumption of beans, fruits and vegetables, and living near a major roadway. The ubiquitous use of recycled aluminum pots is a likely source of lead exposure in this community, as suggested by the significance of beans as a dietary factor, a food requiring extended cooking times. This type of cooking pot has been identified as an important lead source in other LMICs, and the export of this pot has been banned from Madagascar to the neighboring island of Reunion due to high lead levels. Fruits and vegetables, typically sold by vendors on major roadways, may be a source of lead here as well, owing to legacy contamination of the soil. Leaded gasoline was phased out approximately 15 years ago, which is also the estimated half-life of lead in soil. Finally, those children living near a major roadway were identified as having significantly higher odds of elevated BLL status, further supporting this hypothesis. Finally, we compared our data against a recent meta-review of childhood BLL in LMICs and determined that children in Madagascar have higher BLLs compared to both sub-Saharan and global LMICs. In terms of income classification, the median BLL value from our study aligned with that of other low-income countries and exceeded that of middle-income countries. As shown in Figure 3, BLLs systematically increase with lower income classifications. In summary, this was the first study to characterize children's BLLs and lead exposure routes in Madagascar. We measured BLLs of 362 children in Tomasina and conducted surveying to identify potential exposure routes. We determined significant adjusted odds ratios associated with the daily consumption of beans, fruits and vegetables, and living near a major roadway, as supported by previous findings elsewhere. The approach and findings in our study may be applicable for other rapidly urbanizing cities in developing nations. Thank you.
Wyatt, could you share your poster exhibit?
Yes.
We will now open the floor for questions. Reminder that questions should go in the chat tool in Passable. Oh, there's one already. Colin is asking, what are the plans to mitigate the lead exposure now you have the results?
Yeah, thank you for the question. So there has been an ongoing effort to promote social marketing techniques to encourage the local technicians to install non-leaded components into the pumps. Additionally, we are working with the local governments to provide a one-page summary of the results, as well as to provide presentations to the local water committees. Since we know that the use of the pitcher pumps is a significant factor, we feel that the use of the non-leaded components will help to reduce the levels of lead in the water and blood. And we have some recent work to support this in terms of reducing exposure to contaminated soil and dust. That will have to be addressed using hopefully future behavioral changes. There's not too much you can really do about that exposure route since the fruits and veggies are sold on the major roadways by vendors. That's a more difficult aspect to approach. Thank you.
Oh, thank you. She also says go Bulls and that she's one of Jim's former students. That's a nice connection there. I was also wondering about the fruits and veggies. I guess there's not there didn't seem like a direct link, but now that you mentioned where they're sold, it makes a lot more sense that you'd get lead exposure there.
Yeah, and this has been seen in other sub-Saharan African countries before, so it does support our finding here. And then the aluminum pots, I think, is one of the major sources because the export of these types of pots has been banned from Madagascar specifically to neighboring nations from lab testing of the pots. So that's a very likely source. And again, that's another one that's been supported by the literature.
Interesting. There are two more questions. So Colin is asking, so is there still lead exposure from roadways, even though the gasoline is unleaded now?
Yeah, and that's a really good question. So leaded gasoline was banned in Madagascar beginning 15 years ago. So it was likely used past that. That was in 2005. It was likely used past that. And the half-life of lead in soil and dust is roughly 15 years. So we're at that point now. Plus, Tomasina is a port city. It's the major port city of the nation, and there might be continued use of leaded gasoline or other dirty fuels in the port activities.
Thank you. And then we have a question from Lee. He's asking, does it embed in fruits similar to pathogens on the outside, or does it get absorbed into the fruits? Well, that's interesting.
Yeah, that's a really good question. So we think in this situation, it's just being kind of adsorbed on, on the fruits as they're being sold, since they're near the major roadways. But if these vegetables and fruits were grown in the area, and most of them are not, but if they were, they could be, especially root vegetables and certain types of vegetables, they can, there's uptake from the soil into the fruit itself or the vegetable, but we think it's more just on the surface. So that's one potential behavior change, is just to encourage, washing and or peeling.
That's helpful. So we have time for just one more question, and it's from Fui. Do you work or liaise with local governments or trade bodies in Madagascar? If so, what is their response to your evidence?
Yeah, so we work with the local, with the national lab. We have a strong connection with the national lab, and then we also work with some of the smaller local governments, and they're very interested in the results. We have evidence that shows that replacing the leaded components in the pumps, for example, does result in lower levels of lead in the water and blood. So they're very interested in seeing the results and distributing them to the community members. And they in Madagascar, they have these kind of tight-knit communities called fukutans. So by targeting the chiefs of these fukutans and getting the information there, it's a pretty efficient way to distribute the information locally. But they are very interested.
Thank you. There are a couple more comments there, but we need to move on to the next presenter. I would encourage you to go to Pathable to respond there, and stop your screen share so we'll move forward. Thank you. Our next presenter is Effita Masoamphambe, and she is from the Malawi Liverpool Wellcome Trust Clinical Research Program. Thank you for starting the video. Let's get started.
Hello everyone, I am Effita Masoamphambe, and I'll be presenting results for an environmental surveillance study of antimicrobial resistant bacteria that was conducted in 4 markets in Blantyre. So to just set background on this study, we at the moment record high morbidity and mortality rates due to infections that are caused by extended spectrum beta-lactam producing bacteria. And this led us to try and understand the drivers of spread of these resistant infections. In this study, we were more concerned at assessing environmental contamination by ESBL producing bacteria, particularly ESBL E. coli. And we used the ESBL IDEX Colilert system that was developed by the Centers for Diseases Control for identification and quantification of ESBL contamination. But for the sake of this presentation, I'll just present the results for the identification aspect. I didn't add the quantification part. So I'll now take you through the methods. So like I said earlier on, this study was done in markets in urban Malawi, in Blantyre. So there were 4 markets, and we had 2 laboratory methods that were used. The ESBL Colilert method, which was standard in the case of this study, and we used a comparator, which is the chrome agar culture method, which is the conventional method that is currently used. So for the Colilert method, we basically mixed a reagent with a Colilert reagent with 100 milliliter sample of the water that we collected, and 100 micrograms of ceftriaxone, which is a 3rd generation cephalosporin. We sealed and incubated it and waited for 24 hours to read the results. So in the presence of E. coli, the nutrient indicator metabolizes glucorodinase enzyme in the E. coli to produce a yellow color and also fluorescence under a UV lamp. And in the chrome agar culture method, we basically filtered the water, enriched it with buffered peptone water, and then cultured on chrome agar, then incubated. All these methods were done on 4 types of sample water, 4 types of samples of water, which included stored water, drain water, source water, and level water. So this is like a normal market day. This is the stored water. So it is a norm in Malawi that vendors collect water, keep on their benches, and sprinkle it on the vegetables to keep them fresh during the day. So the source is a well, actually. So that's somebody, that's a bucket there, right here. That's a bucket on a well. They're drawing water from the source, which they'll keep in the buckets during the day. And this is a liver. So down here, the results are showing the number of ESBL positive samples for the methods that were used in this study. So the green bar represents the total number of samples that were collected for each. So in the case of the stored water, we had 38 samples. We had 21 water samples from drains. We had 7 samples of source water, and we had 4 samples from liver water. So this was across all the 4 markets. And the blue part represents results for both the Colilert and culture, so positive samples from both methods. The gray part presents results for the number of positive samples for only the culture method, and the yellow is showing the number of positive samples that were recorded on the Colilert system. So out of the 70, 88%, which is 62 of the 70, were positive for ESBL E. coli by either method. We also noted variations in sensitivity of each of the methods, where Colilert reported 52 out of 70, and the culture reported 38 of the 70 samples. We also noted discordance in 27 samples, where only 4 out of 70 were positive on chrome agar culture alone, and 23 out of the 70 were positive on Colilert alone. So in conclusion, these urban markets that were studied are heavily contaminated with ESBL E. coli. And from the graph, we can see that the most contaminated is the water that's used by vendors to keep the vegetables looking fresh. And in these markets are potential sources of ESBL, and transmission may easily occur. And this warrants for surveillance. And should surveillance systems be put in place, we think that the Colilert method may be a more sensitive and simpler method for identifying ESBL contamination compared to the traditional culture techniques. and that ESBL is better off because it also allows for quantification of resistant bacteria. Would also recommend that further validation of ESBL be done in similar settings like this. Thank you so much for listening.
Thank you. If you could share your poster, we'll open the floor for Q&As. And there's already some questions. Perfect. We have about 3 minutes for questions. There's one from Joan. She's asking, given how much higher the ESBL E. coli is in the stored water compared to both the source water and river water, do you think the main source of ESBL E. coli is on the food products themselves from the soil and handling? Then during the day, as the vendors rinse products in the water or put their hands onto it after handling the vegetables, the ESBL E. coli, which is on the foods, gets transferred to the bucket water and is then deposited in drains. That's a great question. I was wondering about the same thing. Effita, you're muted.
Okay, thank you for your question. So I would assume that the reason why the stored water has more ESBL contamination as compared to the source and the other kinds of water is primarily because of handling. So the vendors are dipping their hands into the water, sprinkling over the vegetables. So I'd assume that that's the main point of contamination for this water, because as you can see on the graph of the source, the presence of ESBL is lower, but in the stored water there is more ESBLs. So I'd assume that the point of contact or the point of contamination would probably be the handling.
Thank you. We have just enough time for one more question. Colleen wants to know, how should we best prevent this contamination?
Well, I guess the first thing I think has to do with policy in the areas where we work, because in low middle income settings like Malawi, it's practically very impossible to just from the onset just stop this from happening. So would have to have a lot of education programs on how people have to handle their food. We have to provide more access to clean water, and most importantly, clean spaces for vending vegetables.
Thank you.
Thank you.
And we're just out of time. There's one more question, but if you could go to Patable and answer that there. In the meantime, we'll move to the next presenter. So the next presenter is Wyatt from the Infonomics Labs. And if we can get the video going. Perfect.
Hello and welcome. My name is Wyatt, and I'm an Associate Director at Athena Infonomics and the Innovation Lead at Infonomics Labs. Thanks so much for joining me today. Grateful for your interest in our presentation and interest in Infonomics Labs. So in this presentation, I do want to give you a quick background about Infonomics Labs and then touch on our specific digital technology that we're working on. So, just briefly, an introduction to Infonomics Labs. We at Infonomics Labs are an entrepreneurially minded nonprofit innovation lab focused on cutting edge technological advancement in civic services. So thinking about water and sanitation and those types of things within the urban environment. Our mission is to reduce those barriers currently present within accessing digital innovations and improving the quality of these services in urban environments, working with utilities, cities, and other public and private service providers. Our approach, we have a number of kind of core principles that Infonomics Labs uses. So first, our main approach, we aim to do a sector mapping within a specific sector. So initially we're focusing on water and sanitation. We then conduct a needs and gap assessment. And again, we're focusing specifically on those digital technologies that encompass or that are included in that specific sector. We create a priority list, and we also look at the technical feasibility of it with current and available technologies and costs associated with those. We rank them, and then we, as part of this process, we put them into a kind of a solution development pipeline that you'll see in the next slide, but looking to build them as an interoperable or module set of solutions, because we're focused really on that long-term technology backbone. So thinking about using platform agnostic software development kits to build these digital solutions. So as we build more and more of them with various partners, all of these are going to be able to be integrated based on the needs of the user within the specific sector. And as we continue to do that and work towards with other partners, building out a larger technology backbone that all of these pieces integrate into, we think about enterprise resource planning tools and how that larger scope fits with the sector. So specifically for the kind of that first three steps that we use the solution development approach. So this might be familiar to some of you, but really, again, kind of working from left to right, very similar to, it essentially captures what I was talking about in the previous slide, thinking about needs assessments and the digital gaps that are within certain sectors, and collecting various other, using other ways to collect ideas for digital solutions to problems within water and sanitation service delivery in urban environments, and working through specifically a 45-day innovation cycle to rapidly develop proof of concepts and prototypes to see what might be most feasible within the market, if it's more of a market-oriented product or a social good in that scope. With a key piece, I think, in really focusing from the beginning on the scaling and long-term growth of the actual product. And I think that's central to a lot of what we work on and think about. So as an example of one of these pieces is our early warning system. And so we've been working with a number of different partners in India and Bangladesh and with households to look at the negative effects that overflows in sanitation or in latrines can have both on the operation and the service of service providers, but also the negative effects it has on communities. And so there is oftentimes a cost associated with these inefficiencies. And so trying to fill that using this solution that tries to hit on key market criteria, because this hasn't, this has been done before, certainly with other folks trying to develop this type of sensor. For us, it uses an ultrasonic sensor to monitor, just attaches to the bottom side of a latrine or a septic tank to monitor the fill rate. And the manager of that, whether it's a public toilet or if it's a private toilet for the household, and can be linked into a larger service delivery model with other stakeholders as well. But again, trying to hit on those key market criteria of being available for less than $20, having a 2-year lifespan, and flexible data dissemination and transmission with the product. So again, this is kind of built with this kind of platform agnostic software development tool. So we can integrate it with some of the other projects we're working on, whether it's rapid data collection or image classification modules that you can kind of build up in terms of suites of products to improve services within a single service provider or within a set of stakeholders in an environment. So I was happy to take questions on this or some of the other projects that we're working on in the Infonomics Labs. Thanks so much.
Thank you. Yeah, I think we have just about 4 minutes for comments and questions.
Sure. Yeah. Yeah, it's always rough listening to your self-talk. So thanks for bearing through that. And I'll just kind of add a few pieces. If there are questions, can address those. But really for the Infonomics Lab at large, we're trying to kind of take lessons learned from kind of lean startup approaches and kind of focus on kind of trying to, how do you develop technologies in a rapid prototyping manner to cross that chasm between the early adopters and the early majority of folks, and trying to kind of pull lessons learned from folks like Imago and UNDP and UNICEF and all those pieces with that. And especially when we're getting into hardware technologies, thinking about kind of, if we're thinking about scale, thinking about lean manufacturing and some of those approaches that we take within the hardware aspect. When we're thinking about software, again, I think that all goes back to that kind of platform agnostic approach that, a lot of times what we have in the sector currently is just trying to rebuild the wheel each time because we want local solutions, which is really useful, but we tear our products down to essentially the studs before we rebuild it. And really to localize it, you need about the top 20% as opposed to the bottom 60% that we tear all the way down on. So I think that's one thing that we're kind of really trying to push on folks is that we don't need to go clear back to the studs to really localize some of these solutions, because that allows it to then be interoperable. And so hopefully you can kind of see some things that we're working on, not only the sensor, but also some things like image classification, since there's so much observational data available to us. How do we use those types of things as well? So, and I'm just looking at the questions here. I can kind of see them here, but let's see, how will this work in an area with low broadband or cell coverage? Yeah, so we're trying to kind of, we're starting with a very specific market segment to kind of build out from there. But we're currently looking at just kind of using Bluetooth, Wi-Fi, or basic kind of panel readings for the technology currently to kind of keep it localized and to kind of use the local infrastructure and the local systems that are already in place to provide that data transmission either to the household or to the manager of the public latrine or the larger service provider as well. Joanne asks, Lee, how many ultrasonics do you have installed? And now they're finding, let me move this out of the way. Finding they are offering a cost benefit. Yeah, so we're just kind of ramping up field work right now. Right now, I think we maybe have just a handful in some public latrines in India and Bangladesh and in Chennai and in Bangladesh. So we haven't kind of quite gotten to that point where, let's say, we're halfway through the rapid prototyping aspect of it. But I think one key thing within the kind of space within the within Bangladesh is I think the big market gap there is the 4-day wait time when you have to go in and request a desludging service. And then it takes another 4 days on top of that to it. So we're working with Practical Action and WaterAid to look at how do we kind of shorten those essentially operational costs that are incurred due to the fact that they have these long wait times and inefficient systems. So sorry, we don't have hard data yet on that, Joanne, but we'll certainly share that. And then the last 30 seconds I have from Effita, we did not do any of the quantification. Oh, sorry.
I think that's an answer for to the question that you had put there. I was wondering about their lifespan. You mentioned that it was 2 years, so I was wondering what would need to be replaced out after the 2 years, whether it be a new device or a part of it. Maybe it's because I don't really understand how they work, but that was a question that I had. But sorry, we are out of time.
Okay,
if you can answer my question in Pathable, and we'll move to the next presenter. Thank you so much, Lee. So the next presenter we have is Bernard Elegebe with the Population Services International. And then we can go ahead and start the video. Perfect.
Hello, my dear people. My name is Mr. Bernard Elegebe from Benin, West Africa. I am a wash engineer and at the same time, sanitation marketing experts. Currently, I am working for PSI in Benin, a French-speaking country in West Africa. And at the same time, I am the team leader of SSD. SSD stands for Sanitation Services Delivery Project. So a project funded by USAID in West Africa in basically 3 countries, Cote d'Ivoire, Benin, and Ghana. In this project, we are helping low-income households to build their latrine in urban areas. So we are working with a private sector, with artisans who have been providing affordable and quality latrines to households in marketing-based approach. Currently, per month, we have been selling like 3,000 latrine in Benin. So at the same time, for for the resilience of COVID-19, they used to make also let's say wash stations, devices, and they have been selling also those wash devices to household in Benin. Thank you very much.
Thank you.
Hello. So as I was explaining, in sanitation services delivery in Benin, we work to help low-income people to provide, improve, and affordable latrine to households. But what we want to share with you about this post is that formerly in Benin, it doesn't happen to have women engage in latrine construction. But we were able to break down this barrier because among about 30 artisans, which we have been identifying and trained to build latrine, we were able to involve 3 women who have been also constructing and providing latrine to households in Benin. And fortunately, those 10% of women we were able to engage have been achieved about 20% of all the results we have on board. So the morality of this is that when we were able to engage women in latrine construction, they have all the ability and all the potentiality to convince the other women to build latrine. For instance, in Calaville neighborhood, where women were engaged, we noticed that when those women have 40% women who were able to construct their latrine, at the same time, the males in that neighborhood have been able to engage just 26% women for that latrine construction. So in conclusion, many programs should encourage and require the involvement of women for the sake of gender equity. And we noticed that by involving women in market-based approach, we will get more results. Thank you very much.
Thank you, Bernard. We'll open the floor to questions, and I'll monitor the chat in Pathable. While we wait for questions, you said that you've been selling latrines a lot during this past period. I was wondering if those were the ones that were designed by women in your poster.
Yes, the latrine we have been selling is for instance, the one you can see in the pictures. It is, pit latrines, which we use to improve with the satopan. The satopan is the blue plastic you can see inside the slab, which avoid, smells and also insects, to bother the latrine users.
Thank you.
Yeah.
We have two questions right now. Joanne wants to know, how did you encourage and select the women who were the entrepreneurs?
Great question. We were able to select first. One of the women were, toilet sale agents. At the beginning, she was selling, toilet, and she was leading the community awareness for toilet, purchasing. And one of the male artisan we have on board was, willing to help her so that she can, move from toilet sale agent to toilet construction agent. So let's say that that is the support she got from the male who helped her to become, entrepreneurs. The two other women we were able to engage, we met them also on the communities as women leaders. And we asked them if they can, move from, apart from women leading in communities, if they can also go for toilet construction. They accept this and we train them. After the training, they were able to start that job, and they success tremendously on it, because in that neighborhood, they started selling more toilet by men, and they are also gaining money, and they made their end meet through that jobs, and they enjoy it very well.
Thank you. There's a question asking, what marketing and influencing methods did you find were most effective in selling the toilets? And I think I missed a question too. There's two actually. The first one's asking about overcoming cultural barriers to involve women in construction.
Well, what we notice about toilets, sales approach. Formerly in Benin, it was just one approach for toilet promotion which existed, which is a CLTS. But we noticed that when they implement CLTS in rural and peri-urban area in Benin, after they have certificate those areas end of open defecation, 3 years later, all the toilet collapse and they return back to open defecation. But with sanitation market approach, households were able to construct strong and robust latrine because we taught them how to put money aside to build strong latrine. So let's say that sanitation market approach is a strong approach which can come across the field to be like a complementary approach to CLTS on the field. So those two approaches should be put together for open defecation in our neighborhood in Africa.
Thank you, Bernard. We are almost at time. I want to remind you that their questions are still unpathable if you want to go there and answer them. And if you can stop screen sharing, we'll move on to closing announcements.
Thank you.
I want to thank all of our presenters and all the attendees for a wonderful session. And before we head out, just remind you that there's a networking event at Remo just after this. So interested folks should head out over there. And that's it. That's it for today. Thank you so much.
Thank you. Bye.